Hey class, in this recording we're going to focus on the peritoneum. Well, the peritoneum is also known as the abdominal cavity. It's kind of an older school term for the abdominal cavity, and typically only is used when we talk about the digestive system or the peritoneal membrane. So within our peritoneum, our abdominal cavity, we have mesenteries. And a mesentery is just a sheet of connective tissue that helps to suspend the stomach and the intestines from the abdominal pelvic wall. And this allows, the mesenteries themselves are loose, and this allows for our intestines to have lots of movement, lots of contractions within our abdominal pelvic cavity, but will keep the abdominal viscera, and when we say viscera, think organ, keeps the abdominal organs in the proper relationship to each other, so that we never have the stomach on the inferior margin of the abdominal cavity, or we don't have the descending colon and the ascending colon twisting back and forth, spiraling around each other. Those would just be really bad things that we could have happen. This keeps our intestinal tracts from twisting and tangling with each other, even though we can move, even as we move our bodies around. And it allows for our blood vessels and nerves to have just a structural framework to help them move through the body. As we look at the mesenteries, they're also going to be chock full of lymph nodes and lymphatic vessels. And these lymph nodes and lymphatic vessels help us to process and filter out the incredibly large amount of bacterium that we have within our digestive tract, particularly within the large intestines. Now, as we look at and I'm going to skip ahead a little bit here. So the mesenteries are shown here in this figure. The mesenteries are kind of hard to see, but this gives you an idea of those layers that help hold the intestinal tracts in place. I'm going to back up a couple slides here before I get ahead of myself. So as we look at the parietal peritoneum, that parietal peritoneum, as the name implies, parietal meaning against the outer wall of the cavity, peritoneum meaning this is a double membrane. It's one of the serous membranes of the abdominal pelvic cavity. And as we look at the parietal peritoneum, it turns inward along the posterior midline of the body and forms the dorsal mesentery, or the posterior mesentery. This dorsal mesentery is a two-layered membrane that goes down to the digestive tract. And the two layers of the mesentery are going to pass around opposite sides of all the organs, forming the serosa. And they come together on the far side of the organ and continue to the next. So you could think of it as a sheet of tissue that has organs kind of embedded within the sheet. And then we have, so it will just keep going on. It can hang freely within the abdominal pelvic cavity, or it can attach to the anterior abdominal wall or other organs instead of hanging freely. So as we look at this, we have the lesser omentum and the greater omentum. That lesser omentum is located right here. It's going to be a mesentery that's going to be between the lesser curvature of the stomach, so that little concave curve of the stomach and the curve of the liver, that inferior margin of the liver. It helps to keep the stomach nestled up tight to the liver. And then we have our greater omentum. The greater omentum sometimes is referred to as the abdominal fat apron, or the abdominal apron, just because it folds over the small intestines like an apron. And it has a lot of fat. When somebody has intestinal fat building up, or fat, adipose tissue building up in their abdominal pelvic cavity, a lot of that fat is going to be congregating in the greater omentum. And as a heads up, we don't want fat there. Having fat within the hypodermis of our skin or superficial to the musculature, skeletal muscles of our body isn't necessarily that bad for us, but having a lot of adipose tissue in the abdominal pelvic cavity, or within the abdominal pelvic cavity surrounding the organs, for example, within the greater omentum, that's the really bad fat for us. People that have that fatty buildup have a lot more negative side effects from it. Now, as we look at this greater omentum, its superior margin is going to form some serous membranes around the spleen and transverse colon. So if we look right here, that along that superior margin, that hugs over the transverse colon, and then we have the spleen right over here. It's kind of hard to see. And it is going, that superior margin, as it forms that membrane is known as the mesocolon. And let's go to the next slide here. As we look at the mesocolon, that's an extension of that mesentery that will anchor the colon to the abdominal wall. So here's the greater omentum. It's been reflected upwards so that we can see what's going on underneath it. And then here we have that mesocolon underneath, anchoring the colon to the greater abdominal wall itself. And we also are going to see these terms frequently. This term, retroperitoneal, should ring a bell from when we covered the urinary system. This is an organ that lies posterior and it's going to be pressed against the posterior wall of the body. These organs are typically going to be considered outside of the peritoneal cavity. And as we look at this cavity or this area, the duodenum of the small intestine, the pancreas, and some regions of the large intestine, in addition to the urinary system, are all considered retroperitoneal. When we think of retro, think behind, and then peritoneal refers to that cavity or the membrane of the peritoneal cavity. When we think intra, think inside, and peritoneal refers to the membrane. So if the organ has a mesentery on both sides, anterior, posterior, it's going to be considered within the peritoneal cavity. Examples of digestive organs that are within the peritoneal cavity include the stomach, liver, and some parts of the small and large intestines. That's all we have for this recording. If you have any questions or comments, please feel free to post them in the class discussion board or shoot me an email. And as always, happy studies.